What can you do with a bachelor's in psychology? Hi, I'm Dr. Julia. I'm a licensed pediatric psychologist and I work in an academic medical setting. So some of my answers are going to be a bit more focused for like options in the hospital setting. So if you have your BA or BS in psychology, there aren't really opportunities for therapy. So if you really want to do therapy, that's when you would need to go to step up. So there are things you can do. So there's like behavioral health technician or mental health technician with like additional training. For applied behavior analysis technician, you can do that with like extra certification. You just need your BA or BS for that. You can be a program coordinator, you can do human resources, recruiting, like patient navigator, clinical support staff, case manager, care coordinator, research assistant, or lab coordinator. Those are all things you can do in the medical adjacent setting that is not directly like therapy provision. If you were to pursue a master's, whether that's a master's in counseling, family and marriage therapy, social work, you can either do kind of clinical therapy work or you could do more advanced clinical roles within the hospital setting. So there's also like research tracks. So there's another option for masters if you want to do more like researchy work. So you can do things like research coordinator, data analyst, program evaluator, policy or public health roles within the hospital setting if you don't want to provide therapy services. I would assume that these jobs come with higher pay, maybe some better benefits as well. For a doctoral degree, which is what I have, one, it's free to get. That was a big motivator. So you actually get paid through the PhD program to complete the PhD because you either do research or teaching or some other clinical work to pay for your degree. So that's a benefit. You can provide psychotherapy. And an important piece of psychologists is that we can do assessments and evaluations. If you want to specialize further, you become a neuropsychologist, and that's a separate clinical internship training and fellowship training to make sure you're highly specialized and have more of that neuroanatomy part. But you can teach at universities, you can work at hospitals, you can supervise, you can lead research, you can publish, you can do, well, actually you can publish without a PhD, but you can run a research lab and that kind of stuff with a PhD or a PsyD. And then you can be more specialized. You can also consult, hold leadership roles in hospitals and systems, all that good stuff. So it really just depends what your future career goals are, and then that should dictate how far in your degree you go. Let me know what other questions I can answer.